The mission has changed aboard the USNS Comfort. President Trump has ordered the crew on the 1,000-bed hospital ship to start treating COVID patients from New York and New Jersey only.
Hopefully that will be very helpful to both states.
However, the Navy Times reports this morning one of the patients is a crew member who's being treated in isolation. Governor Cuomo explains each patient requiring hospitalization there first must go to a local hospital before being transferred to a field facility like the Javits Center and Billie Jean King Tennis Center, which is opening today.
The challenge is to make sure that we don't lose anyone who could have been saved if our healthcare system was operating fully.
While still staggering, he says the state had 2 days of a slowing death toll. The number of hospitalizations and intubations are also down.
Possible flattening of the curve is better than the increases that we have seen.
That's why he extended the state's quarantine period until the end of April.
Code 99, code 99.
But hospitals are still on the brink. SUNY Downstate in Brooklyn is just one treating only coronavirus patients, where the human toll is taxing and tragic.
We've had a bunch of people die in a very short period of time, which we, are prepared for. But when it happens so many times in one shift, it's pretty hard to tolerate.
Well, the city saw about 219 deaths alone as of yesterday morning here in the city. To put that all into perspective for you, before we were dealing with this coronavirus crisis, roughly 158 people were dying on average here in the city of 8.5 million people every day. That's the latest. Live on the west side, I'm Anthony DiLorenzo, Pix 11 News.